Welcome to IIP Navi Mumbai. I'm Dr. Gargi and today is Down Syndrome Day.
I am Karyotyping or Big Mirror.
Does Gauri look different to you? Let's explore why. Humans are born when a sperm meets an ovum. They each carry 23 chromosomes and together make a human child with 46 chromosomes. However, sometimes there can be anomalies during division. It's called non-disjunction during meiosis and it leads to an extra chromosome at the 21st position. This manifests as trisomy 21, also known as the Down syndrome. Each individual has unique genetic material. Studies suggest that there are about 50 to 200 unique mutations in every individual. Yet, in total, we all have just 46 chromosomes, whereas children with Down syndrome have 47. Numerical genetic anomalies can be both because of maternal and paternal factors, yet the probability is more with maternal factors. Also, it increases with age, with the probability being 1 in 1600 at 20 years of age, and when the mother becomes 40 years, it becomes 1 in 100, at 42 it becomes 1 in 60, and at 45 it becomes 1 in 30 mothers. When these mutations occur, very normal, healthy parents deliver a baby with Down syndrome. The severity of this ranges from mild to profound, and the therapy changes accordingly. You know, when babies are born, what do? They cry at the top of their lungs. But babies with Down syndrome may not be able to do so because of their hypotonia. They may require assistance to make them cry. Also, these babies have cardiac defects from endocardial cushion defects VSD to PDA, which means they have a hole in their heart, which requires cardiac interventions. Scary, isn't it? But these problems can be solved. There are certain things in children with Down syndrome that require lifelong therapy, such as their profound mental retardation, weakness in musculoskeletal growth, endocrine problems, their hearing and eye problems. So let us look at the unique physical attributes of these children. They have a flat occiput, brachycephaly, a small head and rounded faces. They have inner ectocanthal folds with mongoloid slant, a flat nasal bridge and a protruding tongue, which may be a scrotal tongue. Their eyes have brush-field spots on the periphery of the iris. They may have congenital cataracts, refractory errors and keratoconus. They have early cataracts. These children also have low set ears, there may be deafness and there's recurrent otitis media. They may have delayed dentition with aplasia of enamel and malocclusion of teeth. There's low hairline and a short neck. Their hands have short stubby fingers with a single simian crease, and the fifth finger is short and incurved, known as clinodactyly. Their toes, between the first and the second toe, there's a gap known as the sandal's gap with a crease starting from there to the bottom. There may be an effect on the internal organs as well. Starting from the brain, the average IQ ranges from 20 to 65. There may be profound mental retardation. They have increased chances of having recurrent pneumonias and hypothyroidism. They also have a chance of having acute leukemias, which is blood cancer. So how do we diagnose this condition? It can be diagnosed antenatally when the child is in the tummy. In the first trimester, that is the first 3 months, there are certain blood tests that can tell us the probability of the child having Down syndrome, which include PAP-A, that is pregnancy associated placental protein A, and beta HCG, and on USG there is nuchal fold thickness of more than 4 mm. In the second trimester at 14 to 16 weeks, we can do a triple test for screening by checking the levels of alpha fetoproteins if they are low, unconjugated estriol if they are low, and the level of HCG if it is high. There's a quadruple test which includes inhibin A, the levels of which if are high, we screen it as more probability of having Down syndrome. USG, that is ultrasonography of the abdomen, can be done from 11 to 20 weeks. In the age period between 8 to 12 weeks, if there is increased nuchal fold thickness more than 4 mm, or there's a double bubble sign which denotes duodenal atresia or there's a choroid plexus papilloma, it means that there's more probability of having Down syndrome. Now let's come to the diagnostic tests. Chorionic villus sampling can be done from 10 to 12 weeks. Amniocentesis is done from 11 to 16 weeks. From 11 to 14 weeks, karyotyping is done on cultured cells. And from 14 to 16 weeks, FISH is done on uncultured cells. In the late stages from 18 to 20 weeks, chordocentesis can be done. And on the fetal lymphocytes, karyotyping or FISH is performed. We can also perform tests on the mother's blood. Fetal cells are found in this blood, which can be separated by flow cytometry and used for chromosomal analysis by FISH or PCR. Once we come to know that the child has Down syndrome, it's up to the parents to decide whether to keep the child or to perform medical termination of pregnancy, that is abortion. But remember that abortion can be performed only up to 20 weeks of gestation. These children may have slow development of milestones, but with proper speech therapy, gross and fine motor therapy, they can acquire skills to stand on their own 2 feet. With occupational therapy, 20% of people with Down syndrome are employed. So if you are a parent or carer of a child with Down syndrome or know a child with Down syndrome, here's a list of schools that can help you. But remember, schools are not the ultimate answer. These children need a little extra care and a little extra attention than normal. Not just from the parents, but from the entire society. So let's accept these children as they are.
I accept your child, even though he is a super actor.
I accept your child who smiles less.
I accept your child even if he is aggressive.
I accept your child who's lean.
Accept your child who's lean.
I accept a child who is lazy.
Because each and every one of us is special, and together we make a beautiful community. On one hand, we are trying to detect antenatally as many Down syndrome cases as possible. On the other hand, we need to give children with Down syndrome the maximum chance to reach their highest potential.